Welcome to the Leadership Unveiled podcast series by the HR Association of India. The series explores the minds and journeys of the pioneering leaders, entrepreneurs making waves in the business world. I'm your host, Neha Jagnani, and today we have a truly special guest, a visionary leader and an operational maestro whose journey brings both excellence and inspiration. He's none other than Mr. Neeraj Lal. With over 2 decades of experience in healthcare management, Neeraj is currently serving as the COO of Apollo Hospital in Gujarat Region and is the president of AHPI Gujarat Chapter. Neeraj holds a master's degree in hospital administration from Tata Institute of Social Science, Mumbai, and a degree in medical science from PGI, Chandigarh. At PGI, he was awarded with the Aikat Memorial Gold Medal for Best Outgoing Student in 1996. He is a certified assessor of the Assisted Reproductive Technology Centers Accreditation and the Advanced and Primary Stroke Center Accreditation Program by the QAI. He has won many accolades, such as being among the 24 of 2024 COO Operational Maestros by HR Association of India. He has also been named as the Outstanding Professional-Pharma Operations 2023 by the Institute of Supply Chain Management, Mumbai. He has also received CXO Excellence Awards 2021 for the Outstanding Technology Leader at the CXO Tech Summit, to name a few. Previously, Neeraj had held senior positions in notable Indian hospitals like Medicover Hospital, Rainbow Children's Hospital, BAPS Hospitals, Sunshine Global Hospitals, Shalby Hospitals, and Sterling Hospitals. Neeraj is an expert in operations, strategy, and quality, and is an ISQua-approved surveyor. He holds advisory role for the MBA programs at IIM Bodh Gaya and NMIMS. Additionally, he shares his expertise as a guest faculty member at several Indian universities and business schools. Neeraj, thank you so much for joining us today. It's a pleasure having you here. How do you feel about this?
Thank you very much, Neha, and the HR Association of India for having me in this platform. Thank you very much.
Wonderful. So, Neeraj, my first question for this podcast would be, what inspired you to pursue a career in healthcare management?
Okay. Way long back, somewhere in the 90s, 91, I passed my 12th. I want to do something in medicine. But my father, who was working in IT Roorkee, so there was a career in PGI Chandigarh where they're training basic medical sciences. So I applied there and I got selected. I did my bachelor's from there. So the main bug of healthcare started from there. You know, PGI is one of the famous institute in the term of medical education and technology. So I thought okay, these big time hospital we can able to manage professionally, because there, if you see, all sort of patients are coming. So services are there across. So I feel if we better manage the healthcare institution in a professional manner, like any other multinational company, in the term of business, in the term of operation, in the term of PNL, I think we can make a great difference. So I just started thinking, but I was into the technical course. So at that time, you know, Apollo was starting in New Delhi, if you know, in the year 93, 94. After passing my graduation, I applied there, I got a job there. I started my journey into the healthcare administration there, where I did my part-time hospital management from YMCA School of Business in Connaught Place. So there, you know, I was in the morning, I was doing job. In the evening, I was doing this part-time MBA. So my HOD there, Dr. Sangeeta Rava, told, why can't you do, you are young, why can't you do a full-time MBA? But at that time, I think there are various few institutes in the country. One of them was TIS. So I applied there, you know, gone there, and finally I got TIS from, I did MHA from TIS. And that, you know, that helped me in taking this vertical as my career.
Sure, sure. Fantastic. Truly intriguing, Neeraj. Thank you so much. So my next question is, what trends do you see, Neeraj, which are sort of shaping the future of healthcare management today?
Actually, healthcare management, healthcare is changing. I think pre-COVID and post-COVID is dramatically changed. If you see, when I was passing out from healthcare, you know, we got a placement season at TESS. You know, everybody's talking about operations part of healthcare. But I think now healthcare is a business.
Right.
Many tech companies is participating, many medical equipment companies participating. Now a big fund like private equity fund is also parking their money into the hospitals. So now
Right.
healthcare future is very, very good. If you see every day you see one new hospital is coming up, and all the important chain in the country, they have an aggressive plan. So now if you see the healthcare future, it is tech based. I
Right.
think everybody don't want to come to the hospitals.
Mm-hmm.
Healthcare moving away from the hospitals. You must have seen in the COVID, you are
Yeah.
not requiring a hospital, but you need to be monitored. So
Yes.
now if you see more and more critical care rooms, more and more operation theaters.
Mm.
So I think these are the demand for the future healthcare, but other things are happening at home. Say, for example, Apollo as such, we've started a online consultation.
Mm-hmm.
So majority of the consultation pre-COVID is less than 5%, which is happening on a virtual platform. But
Mm.
now more and more consultation is happening on a virtual platform. For
Right.
a pathology, a phlebotomist can come to your home, you
Mm-hmm.
know, consultation, multi-specialty consultation. So now it is tech-based.
Right.
So number of people coming to the hospital is few.
Mm-hmm.
However, the hospitals are meant for critical care and procedures. Say, for
Right.
example, I'll give you one scenario. The healthcare it will look. A patient coming to the OPD,
Mm-hmm.
waiting for a doctor.
Right.
Doctor sees him, give him a prescription.
Mm-hmm.
He go to pharmacy, he go to pathology, he may or he may not, and goes away from the hospital. So
Mm-hmm.
the touch point of the hospital is very, very few.
Right.
And if you see the hospital now, a tech-based hospital, you
Mm.
go to a hospital, it is pre-booked. Like
Right.
book my show. Your appointment is booked with the doctor. You go there. Your
Mm.
all the vital is taken by a AI-based cameras.
Right.
Your moods, like you are happy, sad, irritated, is captured by a AI-based cameras. So whenever the customer care executive see a patient, his
Mm.
mood is he's not very happy.
Mm.
The image is captured, and she may go close to the patient and say, how can we help you? They can say, I'm waiting for some time. I'm not seeing a doctor. She may
Mm.
facilitate. You go inside a doctor consultation, he's spending more time with you
Mm.
rather than writing a prescription.
Right.
So automatically the software are there, a prescription is made, you know, and instead of giving a proper paper prescription, the prescription goes to his mail ID or a WhatsApp. And there is no need to go to the pharmacy. He reaches to the pharmacy, his jute bag with pharmacy medication is prepared.
Right.
And whenever he go for a phlebotomy, the phlebotomy know what kind of tests I'm supposed to do. So I think we are moving from a manual based care to a tech based care. And I think now you are not in touch with the hospital with the patients while they are in the hospital. You are in touch with the patient while they're at home. So when patient is discharged and goes home, 2 days prior, a message comes or call come from the hospital. Say your medicine is getting exhausted. Why can we send it again? All those things are there. So I think the people who are close to technology, the people who are making a difference into the digital transformation of healthcare,
Mm.
healthcare is moving towards them. Now I can measure my operational metrics, my service excellence metrics via
Mm.
dashboards.
Right.
So I think the things have changed now. The call centers are there in the hospitals. They get connected to a various verticals. So I think that is a future of healthcare. So focus is not a generalized healthcare. Focus is on a personalized care, like a health checkup. Health checkup is becoming very important now. Health checkup is not a blood test. Health
Right.
checkup is based on your diagnosis on a battery of tests and radiology. AI will measure what are the problems happening in your in your heart, in your brain, your diabetes. I think that is a way the healthcare is this way. So personalized healthcare, which is tailoring to the needs of the patient,
Mm.
and technological advancements like AI and machine learning. For an ICU patient, if you see, so ICU patient is a multi-specialty care.
Mm-hmm.
But we at Polo Ahmedabad, like we got around 100 beds, ICU beds, but we manage 5,000 beds. How come? We are connected these ICUs, which is in tier 2, tier 3 city, by a way of machine learning and AI. And the dashboard is there into the main hospital. Whenever, the vitals goes up and down, our doctor monitor and a treatment is given to them. So we don't say we made 100 beds in the hospital, but maybe 5,000 bed away from the hospital. So that is the healthcare which you are seeing now.
Right. Great insights, Neeraj, especially on AI and technology and how the whole sector is evolving, and they will always have an edge if they use the technology in this
Yeah.
way. And it's great insights. Thank you so much. So, Neeraj, my next question is, what key metrics do you focus on, particularly to drive the operational excellence in the healthcare facility?
Yeah, I think if you measure your operation, I believe in one thing, measure what matters. If you're not measuring what is happening, I think you don't have a control over this thing. So I
Right.
think we have operational metrics, we have a service excellence metrics, and we have a quality metrics. So like
Right.
Apollo is a group of hospital. Apollo Ahmedabad falls in the group A hospitals. So there is a monthly metrics result card, one pager report comes for the various hospitals. Say, for example, the measurement. I,
Mhm.
as a chief operating officer of the hospital, supported by the HOD, so
Mhm.
we have a ATCA moments. We
Mhm.
have a ward as a unit, like we do a morning meetings. So
Mhm.
we have a ward as a unit. Ward as a unit means the in charge of that floor, the executive on that floor, the doctor on that floor, the nurse on that floor. They meet in the morning for some time and see what are the issues in the floor, in the
Right.
term of patient care, in the patient services. And
Mhm.
we got one app where like porter based management. So
Mhm.
whenever you are sending patient from a ward to a OT or a CT scan, you're not supposed to call to a porter or a transport. You just see in your app which is the closest porter which they can hire. They see, like, you book a cab, so that person come take the patient to a CT scan and drop the patient there. They don't wait for the patient. Immediately the CT scan is over, the in charge there again use a porter app, see where the closest porter is there. The porter comes, take the patient and back there. So all those things are happening. We do a mystery audit. Some of the clients pose as a patient, goes to a doctor, goes to a pathology, and they rate about your services.
Mhm.
We also create, like, we got many patients from outside India, mainly from Kenya, Tanzania, and all. So whenever these people come, we give them services which they feel at home.
Mhm.
So we measure our operational metrics in the form of a various quantifiable metrics, and we see where we fall, and we try to improve on those services. Like, say, for example, we have a one smart room. Smart room, generally in these nuclear family, generally family don't stay with the patient. So generally patient, most of the time, he's alone. So
Mhm.
the smart room have, if he want to open up a curtain, he
Mhm.
say, hey, can please open the curtain. Automatically curtain get open. He want to hear some songs, he can request, and automatically a song will start. He want to put off the light, he want to put on the light. So I think we say the smart rooms. So I
Right.
think this is a thing which we measure the satisfaction of the patient. We collect all those feedback which we collect from the link, and we see which is the most common word which is coming again and again,
Right.
and we see these are the problem. So now here every HOD has taken over certain rooms.
Mhm.
Like every HOD in this hospital have certain rooms which they go and visit from the
Mhm.
patient side, and they say any problem they are facing, any service issues, any billing related problems, any issues with the doctors. So I think this is a way you control the operation, and at the end of the month you got one pager from the operational metrics which shows where you stand. You are maintaining your rank, you're going down, or you're going up. Accordingly, we work towards patient care and benefit.
Wonderful, Neeraj. Truly insightful. So, Neeraj, my next question is slightly different. I want to know, how do you stay motivated in such a demanding field?
Yeah, you are right. It's very, very demanding. Sometime I got a call from my wife, Neha. She worked for one of the company here. And my son always call, So sometime it is very, very difficult to attend their phone call. I always say, I'll come back to you. You are in a meetings and all those things. So the main, the motivation is, I am on the panel of certain management institutes for their classes. So some of the subjects which I feel, the hospital manager or the future manager know. So I go to IHMR Jaipur, I go to Narsi Monji Institute, I go to Chitkari University, I go to Tata Institute of Social Sciences. So I keep my time, see
Mhm.
to that, in a particular year, I spend some time in the management in school teaching the future healthcare leaders. I
Right.
also am attached to various, you know, accreditation bodies. I am attached with ISQua. So
Hmm.
ISQua mandatory, you need to do certain audit outside the country, either a desktop survey or you need to visit those properties. And since, as you told, I am also on the panel of Quality and Accreditation Institute
Hmm.
for Fertility Center accreditation and advanced stroke accreditation. So I see to that, I view few assessment where I go and see how the hospital is behaving, what are the things which is happening into the world. Plus morning time is me time. I spend 1 hour with me. I got a habit of see sunrise every day. I think sun is a source of energy. I see to that if there is sun, I must see. So whichever city I move for audit or inspection or in the morning at my home, I see to that I see sun. So these are the few things which keep me updated and see to that our future in healthcare management is safe.
Fantastic, Neeraj. So this brings us to the last question for today, Neeraj, which is what advice would you give to the aspiring professionals who are looking forward to enter or create a meaningful impact in the healthcare industry?
I think the students which is passing out from the hospital management institute, like I am on the panel of few of the management institute like IIM Bodh Gaya and Narsi Monji. I think they have to spend more time on the campuses in the hospitals. They have to shadow a manager. They have to shadow CEOs and see how they work. I think this is the most important. Like you, if you spend certain time in the hospital and the departments, you get to know more. Like during my time, I've been placed in various hospital like Breach Candy. I was in Hinduja and I was in Tata Memorial. So I think if you observe them, if you shadow them, that is the main thing. So I think if it is a good mix of practical training
Mhm.
supported by theoretical training, it will make a difference. So I
Mhm.
feel if students spend more time into the practical internships, placement in the different hospital, that will make a difference.
Mhm.
And whatever they taught you into the management courses, I think if you go to the real world, it is quite different in the
Mhm.
term of business of healthcare. So I think do some tech courses, which is apart from your serious MBA degrees. And I think you should also, connected with the healthcare per professional. See, healthcare is not only hospitals, like the tech companies, like various medical technology equipments, private equity companies,
Right.
insurance companies, and become a part of very serious healthcare meeting which is happening in the country. So
Right.
if you interact with the people and if you expose to this outside world, I think you can able to become a better professional, especially into the field of healthcare management.
Sure. Fantastic. Great insights. Neeraj, thank you so much. This brings us to the end of this podcast session. And on behalf of HRAI, I want to thank you for joining us today. It was personally my honor to host you today. Thank you so much.
No, thank you so much. I think thank you for having me on this platform, and looking forward to have more and more students take this field and make a difference into the patient care and safety. Thank you very much.
Thank you. Thank you so much, Neeraj. I'll just have a quick note to our listeners. If you enjoyed today's conversation, do not forget to subscribe and leave a review. Until we meet next time, stay inspired and keep innovating. Thank you so much.